The reality is, despite our best efforts, we're dealing with a wildfire at our long-term care homes right now.
Ontario says it's going to redeploy every resource to long-term care homes. This as the province extends the state of emergency another 28 days. Remembering the life of Bishop C.L. Morton Jr. He died on Saturday. The pastor served communities in Windsor and Detroit for more than 5 decades. I'm Chris Ensing. Thanks for joining us. We start tonight with the latest on COVID-19. Premier Doug Ford has extended the state of emergency for our province. That's going to last until at least May 12th. It also means that students will not head back to school on May 4th. Here's what else is happening in our region. At least 13 people have died of COVID-19 in Windsor, Essex. 10 of those deaths are people that lived at 3 long-term care facilities. There are 7 outbreaks at those care homes as of this afternoon. We have at least 349 people who have tested positive for the coronavirus in Windsor, Essex. That's nearly as many tests that are still pending. 30 people have recovered from the virus, according to our health unit. We're seeing more enforcement of those Emergency Act measures as well. The OPP gave 2 people tickets in Leamington this weekend, and Windsor's police service has issued 4 tickets under the Emergency Act. Those fines can cost hundreds of dollars. Meanwhile, in the Lambton region, 10 people have died because of COVID-19, 119 positive cases. 6 of the people who died were at the Landmark Village home in Sarnia. And meanwhile, in Chatham, Kent, there are 25 people who have tested positive for the virus. No one is in hospital with a confirmed case of COVID-19 as of today. The Premier says that those long-term care homes are quickly becoming the front line in the battle against COVID-19, adding that that's why Ontario is launching a new strategy to fight the virus in those locations.
And tonight, we'll issue a new emergency order that will ensure every employee in these long-term care homes can only work in one home.
Allowing employees to only work in one location will hopefully prevent the virus from being spread from home to home. Ford is also ordering that hospitals which haven't seen a surge in COVID-19 patients redirect staff to homes that are struggling with an outbreak. Also, new infection control measures are being put in place, and specialists will be going into long-term care homes to ensure that they're prepared. The Premier says the new plan includes money to cover additional staffing needs. He reiterated that the government's top priority is to enhance testing in those homes. Now, Ford said that the province will redeploy every resource to long-term care homes. With 10 of our region's 13 deaths linked to those kind of facilities, we're starting to see a shift locally. Paramedics now are going into long-term care homes to test seniors and staff for the virus. They're called vulnerable patient navigators, and they've already tested dozens of seniors. The CBC's Jason Vio joins us live to look at more of this. Jason, let's start with EMS. How did this all come to be?
Well, Essex-Windsor EMS worked alongside Windsor Regional Hospital as well as the local health unit to develop this new protocol that we're seeing. And it's for long-term care homes like this one here, Riverside Place on Lozon. It had an outbreak of COVID-19, but the health unit says just recently that that has been resolved. But over the weekend, the health unit did reach out to Essex-Windsor EMS to go to another long-term care home that is currently experiencing an active outbreak and test everyone there who hasn't already been tested. So that was 67 tests they did in a span of 5 hours. And this is in line with what the province announced on Friday and again more firmly today, that they're putting more of a focus on long-term care homes and frontline healthcare workers.
Most of the residents in a long-term care home are there because they don't have the capabilities of getting out to things like an assessment center, right? So the reason why we're focusing on those populations is because of that. We want to make sure that we can bring it to them. We're in a world right now of self-isolation and quarantine and staying home. So if we can go there, our paramedics are highly trained in proper PPE, personal protective equipment, donning and doffing. We control the environment. We go in carefully. We withdraw, proper disinfection. It's all about minimizing our risk here. And that's exactly what we do. We want to keep them in their environment, go in, and then pull back out. is basically a needs assessment. We knew that there's going to be a need for more testing, and we were able to realign some resources and get it done. We have our sights on integrating specimen collection into traditional 911 response. It's not happening right now. It is on our radar. So we're kind of sharpening our teeth on our fantastic relationship with the health unit in Windsor Regional to get everything up and running. But phase 2, we would like to see that happen.
And you heard him talk about phase 2 there, Chris. No timelines attached to that just yet, but again, they hope to have that up and running soon. And that basically means, as he said, they hope to test for COVID-19 beyond what they're doing now and actually do it when they respond actively to 911 calls. Chris.
Jason, sticking with long-term care homes that are in our community, we continue to hear from people who have loved ones inside of those homes, some of them in those that have those outbreaks. How are they feeling about the situation as things sit today?
Well, Chris, they say it's kind of scary for family members trying to stay connected with loved ones, kind of from the outside looking in as all of this is unfolding. They can't do much. We hear stories about them showing up to long-term care homes and being outside of windows and speaking through the phone, and that's really all they can do because they can't go in and those in there can't come out. And there's also a concern we heard today that there isn't enough testing being done at long-term care homes, but it sounds like from what the government is saying today and from what Essex-Windsor EMS is doing, that might change. And one woman we spoke with who says she's worried, says her mom lives at Heron Terrace, and that's where there are 3 deaths already associated with COVID-19.
Oh, I was a mess. I called like 3-4 people just crying because I didn't know what to do. She's getting depressed. She's worried. Like, she used to have 6 people sitting at her table, and she's down to 2. The rest are sequestered in their rooms. I'm scared for her. I'm scared for a lot of people, but I'm scared for her because I know if she got it, she has COPD. She quit smoking 40 years ago, but if she got it, she'd be dead. 92-year-olds don't do well with this.
You can hear the worry in her voice there, as well as many others in our community, and that's because, as you mentioned, Chris, there are 7 long-term care homes in our region that are experiencing an active COVID-19 outbreak, and there are 10 deaths associated to those outbreaks in Windsor, Essex. Chris.
Thanks, Jason. CBC Jason Vio live tonight in front of a home that has found a recovery after an outbreak. Meanwhile, a barge carrying tens of thousands of gallons in diesel fuel is stuck ashore near Pesh Island. The United States government and the Coast Guard are on the scene. They say that no fuel is leaking at this time. Here's a look at the barge and a tugboat by its side this afternoon. Now, this happened early yesterday morning. A spokesperson with the U.S. Coast Guard says that no one was injured and no apparent environmental hazards either. Now, this is on the far east side of Pesh Island. Because it's on the U.S. side of the water, though, Canada is not involved in the incident, but they are keeping an eye on things. NWIN says they're on high alert, but stress there's no risk to anyone's drinking water at this time. The Special Investigations Unit is investigating a disturbance call here in Windsor. Here's what we know. Early yesterday morning, police officers were called to Marintet Avenue. There, they found a 30-year-old man who was a person of interest. There was an interaction between the officers and that man. He was arrested and then taken to hospital with a serious injury. The unit has assigned 3 investigators and 1 forensic investigator to this case. Windsor police were not able to comment or add any more details. Treating patients with COVID-19 who need to be put on a ventilator is putting a strain on the supply of some critical medicine. Queen's Park reporter Mike Crawley now with the steps that the province is taking to make sure hospitals don't run short of these drugs.
Put a patient on a ventilator, the machine is only part of what's required. Certain drugs are crucial to sedate and immobilize the patient.
We need to take the human being out of the equation so the machine and my team can do the work they need to do to help prevent the respiratory failure from worsening.
COVID-19 patients use these drugs at double or even triple the rate of other ventilated patients, and that has Ontario hospitals eyeing their stocks with concern.
It's becoming increasingly apparent that some of the most essential medications that we require to provide mechanical ventilation may also be in short supply.
Doctors say the medications that they're most worried about are 2 sedatives and a neuromuscular blocker called rocuronium.
the whole world wants these same medications to provide the same therapy. So this is a real concern.
At the rate that COVID patients consume the drugs, the current national supply will only last a month or two, says this hospital pharmacist.
These patients who have COVID are requiring more of these medications when they're being ventilated, and they're requiring ventilation for a longer period of time. So there's kind of a dual pressure there.
Medical sources tell CBC News that the province has established a task force to do 3 things related to these drugs: to figure out the existing supply at hospitals, to develop guidelines for conserving the drugs, and to arrange for future shipments.
We're prepared to go and negotiate with other countries as well to get the active ingredients that we need in order to make these medications, because we know that there is going to be demand for them.
The hope is that physical distancing measures will slow the spread of the virus enough that there's time to build up the drug supply.
The longer we can give the health system the ability to ramp up production and to be able to cope with this potential surge in patients, the better off we'll be.
There's potentially good news on this in the latest provincial stats. The number of COVID-19 patients on ventilators is far fewer than projected 2 weeks ago. Mike Crawley, CBC News, Toronto.
A local company that once focused on cannabis is now switching to COVID-19. They've come up with a test they say can detect for antibodies in COVID patients. It took a partnership with local scientists, hospitals, and a pair of mold makers to put all of this together. Otishe Bioscience says that Detroit's Henry Ford Health System is using the blood test for frontline healthcare workers. Now, it's not been approved by Health Canada for use here, but I did get to speak with Dr. Philip Ola to show me what this test looks like.
So you have a control line which proves that the test is valid, and then you have a G line and an M line. So the G and the M are antibodies. So if you have a G line showing up, it means that you have potentially been exposed to the virus and your body has developed antibodies that probably fought the virus off. You may have been symptomatic, you may have probably been asymptomatic, and you wouldn't have known that you were sick at all, but what you have is a level of immunity. Now, scientifically, we don't know how long the immunity lasts or how strong it is, but we do know that if your G line is coming up, that you have some protection. If the M line is coming up, IgM, it means that you have antibodies, so the M and the G might come up together, and it means that you are going through a recent infection. So you might still be contagious and you might be spreading the virus. So in that situation, you want to get what we call a virology test. So the virology test is a swab that they do in the throat, and that tells you that you have an active virus in your system.
What is happening as far as being able to use something like this in Canada?
It is difficult right now because we don't have the approval that we need to actually launch this in Canada. We've submitted the application to Health Canada, and we're not the only ones that's waiting, but everyone's waiting for Health Canada to approve this kind of test. And we're hoping that, something happens soon and they get on it, so that the projects and the initiatives that are going on all across Canada that require this kind of test can go ahead with this test being approved.
To be able to offer this to a place like Henry Ford at a time when they're trying to, figure out more about this virus, how does it make you and your colleagues feel?
Oh, it's a great privilege, and we have a lot of nurses that are close friends and doctors that are close friends that work over there in Henry Ford. So to be able to join them on the project and create something like this and make it available to them, because we know what value it's going to add to their product. That just makes you feel good. And this is not just my company. There's 2 additional companies in Windsor that are joining forces with us to get this test created. And just to let you know, getting this kind of plastic from China is an absolute nightmare at the moment because supply chain is disrupted. So we're working with Crest Mold and Integrity, 2 great mold makers in Windsor, and they're creating the plastic that we're using to create this test. So it's not just us, like the whole community is rallying together, to create this notion of let's create a diagnostic test that we can use for the whole population, which is cheap, cost effective, and it gives you the information that we need to make informed decisions about how do we deal with our society after and while it's going on.
An internationally renowned pastor in Windsor has died. Bishop Clarence Leslie Morton Jr. served the community for more than 55 years, both here and in the United States. The CBC's Mina Aziz spoke to some of those closest to him about the legacy that he leaves behind.
He's real in my soul.
Bishop Morton Jr. is known for his electrifying sermons, like this one. He began his career in 1962, preaching in churches around the world, mostly in Windsor and Detroit. He also officiated marriages and ordained ministers. Morton Jr. died on April 11th of unspecified health problems. He was 77 years old. Yvonne Morton is his wife. They've been married for 31 years.
How would you describe your husband? What kind of person was he?
Wow. Okay. He was a man of God first. He was one that loved God all of his life. From what I heard when he was a little boy, in lieu of going outside playing with the other kids, he would be inside reading and talking about the Lord and reading his Bible. And the kind of man he was a man that wanted to win souls for God. That was his life. Ministry is his life. That's what he's always done. And he loved people. There were so many young men and young women that came up in ministry under him that are pastoring churches of their own now.
Michael Brown had known Bishop Morton Jr. for 25 years. He says Morton Jr. was humble, full of knowledge, and loved to help young people. When asked what he's going to miss the most about the pastor, Brown says his voice.
He could sing a song, a simple song, and just have you just smiling and laughing and clapping. He did it with such conviction, with such joy.
And I could hear that servant testify.
He just had this presence. When he stood in the lectern or on the stage, you just were drawn to him. Like, he just had such a presence. His voice was so rich and so eloquent. And when he spoke, it was just like music on the water. Just an amazing. You had to experience it.
I've never heard anyone, and I'm not just saying that because he was my husband, that could preach the word of God like him.
Holding out for a time when people can be together again physically, friends and family plan to celebrate his life in September, marking what would have been his 78th birthday. Mina Aziz, CBC News, Windsor.
A voice like music on the water, a beautiful way to describe a passionate man. We'll have the weather coming up next. We have a flood warning to tell you about tonight for parts of Leamington and Peely Township. These photos that you're looking at here were taken today between Sturgeon Creek and Mercy Road 12. The road here has been closed as strong winds are expected to continue into tomorrow. Meanwhile, along the shoreline, Erie Shore Drive, they're seeing flooding as well. It will remain a problem for people that are living there as winds have slowed. The Lake St. Clair shoreline is also of concern, especially around Lighthouse Cove, which you're looking at here. There's a separate flood warning issued yesterday. Officials say water levels in all of these areas are expected to rise steadily until June or July. They suggest residents living along those areas come up with plans to stay with friends or family in the coming months if it's needed. Joining us now for a look at the weather is Colette Kennedy, but before we get there, you found something that you want to show us that might pick our spirits up a little bit.
Well, I am hoping so, certainly, Chris. You know, these difficult times, we're in quarantine, we had a holiday weekend, you can't be with your loved ones necessarily, but it's especially hard when somebody is celebrating a milestone. So someone was celebrating their 100th birthday, and what a way to do it. We've seen all these images. We've seen all these images of fire departments going out to show appreciation to the frontline workers. Here's another lovely thing they're doing. This was in Markham, Ontario, the fire department there coming in from Unionville, hall number 95, and showing appreciation to someone I happen to know. This is my partner's grandmother who turned 100, it turns out, this past weekend. And so it was so lovely for them to do that. Really appreciated that. And so Elizabeth Fraser, Grandma Fraser there, and celebrating. Look at Chris, she got a bunny cake.
Oh,
pretty nice too.
I can't wait till I turn 100. Firefighters and a bunny cake?
There you go. That's what happens during COVID-19, I guess. But we really, really appreciated that. And so great to see some of these first responders showing their love in different ways. So that was very cool. And speaking of cool, the weather. Yeah, how about that segue? We are looking at temperatures running below seasonal for sure. 5 degrees in Windsor, Chatham, Ken at 4. These winds still a problem, not as bad as they were on the weekend, but of course that was a real issue there, what we were seeing with some of that flooding. Well, those winds tonight still coming in over 40 kilometers an hour, and we're seeing some lake effect stuff here. Spotty, what's mostly some wet flurries. We continue to get some of that in the overnight. It backs off as those winds will back off, and then as they come back, some wet flurries, that potential again through the mid part of the day again tomorrow, and the colder air in place for a few days, and then we'll start to see things rebounding and getting us back to where we should be for this time of year. But tonight, that's not it. When we're at -3, feeling like -7, 5 to 6 degrees around southwestern Ontario for your highs. Thursday, a little better, and hey, at least some sunshine. And then look at how we pick it up as we head towards the weekend, Chris, and get those temperatures going up there. Something else to celebrate.
Absolutely, and a happy birthday once again. 100 years, it's something special.
That's right. Thanks,
Colette. Coming up, we're going to show you a look at how Windsor has rallied to support a new mom after she gave birth to her daughter earlier than she expected. A new mother in Windsor says she's floored by the support shown by our community. Nicole Bitzer gave birth about a month earlier than she expected. She came home from the hospital this weekend and found a bunch of donations piled at her front door.
It just went from like something small to like a big forest fire. I don't even need to worry. Yeah, people just dropped some things off right now. So the only thing I have to worry about is getting Mom healthy and making sure Abella's healthy and gets to come home.
That right there is baby Abella. Bitzer calls her a miracle baby. Now, she needed a blood transfusion, but is doing well. The family says she's making progress. And here's a look at some of the items that were dropped off, courtesy of that donation drive. Now, that drive was started by her sister. It's 6:29 p.m. and that's it for CBC Windsor News. But we want to leave you with a look at people who are helping here in our community. The Iraqi Canadian Group organization is handing out masks. You can see the lineup right there. They've made more than 1,000 of these masks and they've been handing them out to the public for free. A big turnout today. You can see the lineup of going around the corner there as people try and grab one of those free masks that are being offered. Thanks for watching tonight. Have a good evening.